Child abuse or neglect is defined as non-accidental trauma that leads to physical injury, emotional harm, or sexual violation of a minor. Abuse can also take the form of neglect, which is the failure to provide a safe environment where the child's basic physical, psychological, or educational needs are met. Nurses are often in a position to help identify abuse or neglect. Early recognition leading to intervention and support can help reduce or avoid further incidents. In the United States, federal legislation requires that certain individuals, including nurses, physicians, and other healthcare personnel, report any suspected child abuse. Each state determines the definition of maltreatment and identifies to whom abuse is to be reported. In addition, many states adhere to a good faith reporting policy, protecting providers from prosecution should suspicions turn out to be unfounded. Certain factors put adults at risk for becoming abusers. Many abusive and neglectful adults were themselves victims of childhood abuse. Other factors include poor parenting skills, frustration and poor coping skills, isolation from the community or social groups, competition for emotional resources like affection and attention, altered family roles, a lack of trust within and outside of the family, altered family processes such as substance abuse or mental illness, rigid family rules and roles, financial strain, and a dominant family member who controls others with manipulation, intimidation, and aggression. While most caretakers at risk have one or more of these characteristics, it is important to remember that not everyone with these risk factors becomes an abuser. Likewise, children without risk factors can become victims of parental abuse, but there are certain characteristics of children that tend to trigger abusive behavior. They are prematurity, altered bonding, chronic illness, developmental delay, irritability, poor feeding, ADHD, learning disabilities, emotional disturbances, and frustrating behavior. Combine one or more of the risk factors for adults and children with the environmental risk factors of poverty, lack of education, crowded living conditions, lack of positive role models, and availability of drugs and alcohol, and the stage is set for abuse. What are the signs and symptoms of abuse? The physical signs of child abuse vary and can be difficult to substantiate. The client's past history is an essential component of assessment, often providing revealing clues such as previous admissions or ED visits for other family members, a delay in seeking care, or a history of the occurrence that doesn't match the injury. Remember, injuries are typical during childhood. Active youngsters fall off bicycles and get hurt during sports-related activities. When you suspect abuse, however, you'll see certain patterns of injury. And what should you be looking for? A few examples are injuries in various stages of healing, spiral fractures, head injuries, marks in the shape of identifiable objects like wire hangers or belt buckles, cigarette burns, and stocking or glove-like burns from immersion in scalding water. Broken long bones, ribs, skull, and vertebrae are strong indicators of battering. Transverse fractures are a result of direct trauma. Spiral and epiphyseal fractures of the long bones come from rotational and bending forces, such as grabbing and pulling a child from the arm. A retinal bleeding with no other overt signs of abuse may be the result of violent shaking. They include social isolation, withdrawal, running away from home, truancy, laziness, poor school performance, inappropriate or bizarre behavior, aggressive or promiscuous behavior, sleep disturbances, suicide attempts, and physical signs like sexually transmitted diseases, urinary tract infections, and vaginal or rectal bleeding or trauma. Another form of abuse is emotional, such as unreasonable parental demands and expectations, such as making a child sit still for long periods of time without moving or expecting a child to carry out adult duties and responsibilities. Constant criticizing, deriding, insulting, rejecting, and teasing are other forms of emotional abuse. Behavioral signs to look for include social isolation, withdrawal, aggression, depression, sleep disturbances, poor self-esteem, disruptive behavior, and learning disorders. There are many nursing care concerns related to child abuse. You would identify children at risk and signs of maltreatment, report suspected abuse and document your findings in detail, document exact quotes from the child, parents, or care providers, do not document your opinions or conclusions, treat injuries and provide comfort measures for physical pain, provide emotional support for the child and family, be careful not to assign blame until all facts are known. Assure the child's safety. Be alert for contradictions in accounts of the injury. Collaborate with a multidisciplinary team to meet the child's and family needs. Your discharge teaching should include safety issues and referrals to appropriate local, state, and national agencies that offer parenting information, support groups, and special services.